Let's go to organ relationships. The topic is heart and liver and heart and kidney. The heart and the liver. The physiological relationships is blood circulation. The heart governs blood circulation and liver stores blood. In mental activities, the heart is in charge of mental activities and the liver regulates emotional activities. The relationships between the heart and liver are signified as circulation of blood and regulation of mental activities. Physiologically, blood is stored in the liver and distributed through the whole body by the heart. The normal blood moving function of the heart relies on the dispersing and blood regulating functions of the liver. On the other hand, the heart is in charge of the mental activities while the liver governs dredging, dispersing, and emotional regulating activities. The heart and liver are closely related to each other in regulating mental and emotional activities. Pathologically, it is often seen the patterns of heart and liver blood stasis, heart and liver blood deficiency, and exuberant fire of heart and liver. For example, deficiency of both liver and heart blood will lead to symptoms of pale complexion, palpitation, dizziness, dry and lusterless nails, and scanty and light-colored menstruation. The heart and the kidney. The physiological relationships is heart-kidney interaction, heart-kidney non-interaction, heart-kidney fluids nourish each other. The relationship between the heart and kidney is mainly manifested as coordination between water and fire, as well as interdependence of essence and spirit. According to the Yin-Yang theory, yin and yang must coordinate physiologically, leading to the origination, development, and changes of things. And according to the theory of ascent-descent of yin-yang or water-fire, the one that is located superiorly should descend and the one situated inferiorly should ascend. The heart lies in the upper jiao, which belongs to fire in the five elements. Therefore, the heart fire should go down to warm the kidney water. The kidney lies in the lower jiao, which belongs to water in the five elements theory. Therefore, the kidney water should go upward to assist the heart yin for restricting heart yang. Such coordination between the upper fire and lower water is called coordination between heart and kidney. The heart governs mental activities while the kidney stores essence to produce marrow. Therefore, the heart and kidney maintain the mental activities simultaneously. Pathologically, if kidney yin fails to nourish heart yin due to insufficiency, or heart fails to descend to warm kidney water, it will lead to imbalance between the heart and kidney. Symptoms such as insomnia, irritability, tinnitus, lower back soreness, and seminal emission appear. Thank you for your attention.
Let's proceed to interviewing with the topic blurred vision. Blurred vision, called muxian in Chinese, indicates not only blurring of vision and floaters, but also includes a slight dizziness. Although blurred vision is a relatively common complaint, when asked whether they suffer from it, most patients will either answer negatively or not know what we mean. Thus, this question should be asked in a different way, such as, do you have any problems with your vision? Or is your vision sometimes unclear? First of all, it should be remembered that the eyes are under the control not only of the liver, but also of the gallbladder and kidneys. Especially in the elderly, a kidney deficiency is often at the root of eye problems and blurred vision. Among the deficiency types, the most common causes of blurred vision are liver blood or liver yin deficiency. If blurred vision is associated with dryness of the eyes, it suggests either liver yin deficiency or liver and kidney yin deficiency. This is common in the elderly. Blurred vision also may be due to excess patterns such as gallbladder heat, liver yang rising, a common feature in migraine, liver fire, and phlegm. Phlegm in particular is not often recognized as a possible cause of blurred vision. It may cause blurring of vision because it obstructs the clear orifices of the head, including the eyes. For the same reason, phlegm may cause tinnitus. To summarize, blurred vision in liver deficiency will come with floaters and dizziness. Blurred vision due to liver yin deficiency will manifest with dry eyes. Blurred vision due to kidney yin deficiency will manifest with dizziness and tinnitus. Blurred vision due to gallbladder heat will manifest with eye pain and red eyes. Blurred vision due to liver yang rising will manifest with headache. Blurred vision with due to liver fire will manifest with red, painful eyes, and blurred vision due to phlegm will manifest with dizziness and muzziness. Thank you for your attention.
We continue with Yang Shen. This time we discuss compliance. The greatest chance of relieving and preventing the recurrence of a disorder in a patient exists when the person actively participates and cooperates in their treatment by making relevant changes in their diet and lifestyle. In order to get the patient to assist in their treatment, it is important to explain to the patient which patterns of imbalance they have and how these patterns may have a reason. Then you can tell them what they can do to help promote the healing process. Most patients are interested in making relevant changes, especially when they can see a logic in the advice they are given. When explaining to patients which patterns of imbalance they have and how these have a reason, it is of course important to explain these concepts so they are understandable to a layman who has not had a 3-year training as an acupuncturist. As well as there being differences in what advice you would give to each individual patient, there are also differences in how to present this advice to different people, especially in relation to the amount and the extent of the changes that they should make. All of this will, of course, depend upon the patient's patterns of imbalance. Some clients will get overwhelmed or give up if you give them too much information and too much advice in one go. Others can accommodate more and will be more motivated to change their habits and diet. It is often a case of suggesting small, realistic changes. It is difficult enough to change long-term habits in general, but this is even more complicated with regards to the diet. This is because there are so many factors that come into play in relation to why we eat, what we eat, and how we eat it. For some, the situation is further complicated by the fact that they are not fully in control of what they eat. This may be because they eat in the canteen at work, share their meals with others, or frequently have to eat out. Implementing 75% changes that are maintained for weeks, months, or years is often not only more realistic, but also more beneficial than making a 100% change for 14 days or 3 weeks, only to return to the original diet because the dietary changes were too hard to maintain. It is hoped that when the patient makes relevant changes in their diet, they will experience an improvement in their symptoms. Often, they will also experience a deterioration of their symptoms when they eat at some point, do eat what is detrimental for them. This will in itself create a motivation to continue with the dietary changes. It will also result in a completely different chi dynamic. They will no longer experience the dietary changes as a set of rules and restrictions dictated by their therapist, something that may cause their liver chi to stagnate and prevent them from consuming things that give them pleasure, that is, nourishing their heart. Now, they begin to experience motivation. They, for example, no longer want to eat wheat and cheese because this will result in a state of discomfort and they feel better when they don't. This motivation will have a completely different effect on their chi through a perceived ban. It may even end up benefiting their heart because they now feel that they are doing something that is good for them and are taking care of themselves, which makes them happy, thereby nourishing their heart chi. It is not enormously important that our advice does not become an etiological factor in their imbalances. This is especially important when they do not live up to their own expectations and their perceptions of our expectations. This can result in feelings of guilt and a lack of self-esteem, which will have a negative impact on their liver and heart chi. Undergoing a course of treatment, any treatment that involves having to make changes in your diet and lifestyle habits, is something all therapists should try. It helps to create a sense of understanding when a client has difficulty conforming to the advice we give them. We sometimes share with the clients our own experiences and failings as a client of others. It can be a relief for them and their conscience to know that we are not different from them. It also helps to bring us down from the pedestal that they often have put us up upon. There are, though, other types of clients who benefit from a more stern approach where you are more strict and give them little leeway, either because of the severity of their condition or because of the type of person that they are. This means that we must constantly adjust our approach from client to client, sometimes being strict, sometimes being understanding and accommodating, sometimes being humorous, and sometimes being stern. The severity of the patient's condition will usually be a significant factor. A person who has a slight aching in their lower back will probably be less motivated to make major changes in their life than someone who has just been diagnosed with a serious heart problem. The verbal strategies that you utilize in all these situations will depend on your own character and temperament, as well as that of your client. We do not think that there are any hard and fast rules of how to get clients to comply with therapeutic recommendations, and each situation must be tackled individually. In general, it is best to dose your advice and only give the patient new challenges once they have implemented the previous ones. Thank you for your attention.
Let's go to diagnosis according to Jiao theory. The topic is damp heat in upper jiao. Damp heat in the upper jiao is an early stage of a damp heat invasion. The lung and the skin are affected. The etiology is exposure to damp heat pathogenic qi. Fever that is highest in the afternoon is one of the symptoms and signs. There's also nausea, aversion to cold, heavy and aching arms and legs, poor appetite, abdominal bloating, heavy headache, chest oppression, lack of sweating or sticky sweat, fatigue, diarrhea or constipation, greasy yellow tongue coating, and the pulse will be rapid and slippery. The key symptoms here are heavy headache, heaviness in the limbs, rapid and slippery pulse. The treatment principle for this is expel and drain damp heat and activate Wei Qi. The acupuncture points to choose from are Du 14, Li 4, Li 11, Lung 7, Spleen 3, Spleen 9, Ren 12, and Pericardium 6. Needling technique is draining. The explanation for the points is Du 14 drains heat and activates Wei Qi. Li 4 and Lung 7 activate Wei Qi and expel pathogenic Qi. Li 11 expels pathogenic Qi and drains damp heat. Spleen 3 and Spleen 9 drain damp heat. Ren 12 and Pericardium 6 regulate the Qi mechanism in the middle and upper jiao. For relevant advice, when there is an invasion of damp heat, the person should avoid consuming food and beverages that create damp heat. An invasion of damp heat can be caused by no previous pattern, but it can result in middle jiao heat, lower jiao heat, pericardium heat, and spleen qi deficiency. Thank you so much for your attention.
Let's proceed to Zhang viscera with the heart and pericardium. The Zhang viscera is a collective term for the heart, the lung, the spleen, the liver, and the kidney. Although each has its own physiological function, under the guidance of the heart, the functions of these 5 organs are interdependent and cooperate to maintain all the normal vital activities of the body. The heart is located in the thorax above the diaphragm. It is surrounded by the pericardium. In Chinese medicine, the heart is the house of the mind, the master of blood, and the governor of the vessels. Among the 5 elements, it belongs to fire. Complemented by the other Zhang organs, it has the function of controlling all the vital activities of the body. Thus, the plain question states, the heart is the lord of all organs. It is where the spirit arises. Now let's go to its physiological functions. First, the heart is the governor of blood and the governor of blood vessels. Mastery over blood has 2 meanings. First, the heart takes part in the formation of blood. Secondly, the heart promotes the circulation of blood. The heart beats continually, propelling the blood through the vessels so that all the organs and tissues receive nutrients and can maintain their normal vital activities. This is why the heart is known as the organ of motive force for blood circulation. In Chinese medicine, it is the heart's qi that enables its normal beating and that provides the motive force for the circulation of blood. The blood that is controlled by the heart is called the heart blood. By the theory of yin and yang, qi belongs to yang and blood to yin. This is the reason for the terms heart yang and heart yin. Coordination of qi, blood, yin, and yang of the heart maintains a relative equilibrium of normal physiological activities in the body. Mastery over the blood vessels also has 2 meanings. First, structurally, the heart is connected to the blood vessels. Secondly, the vessels are the passages through which the blood is propelled by the heart. These vessels deliver the blood to all parts of the body. The heart controls the vigor of this flow, and the degree of this vigor can be judged directly from changes in the pulse profile. These two functions of the heart are intimately and inseparably related. Only when the heart chi is sufficient can the heart keep the blood flowing normally within the vessel. Mastery of the heart's function, is normal or not, can be examined objectively by the pulse profile, the complexion, and other findings. For example, when the heart chi is abundant and the blood full, so that the heartbeat is strong, then the blood will flow smoothly. This is manifested as a regular pulse that is forceful at an even rate of 4 to 5 beats per breath and a red and lustrous complexion. Conversely, if the heart chi and heart blood are insufficient so that the heartbeat is weak, then the pulse is irregular and thread-like or feeble, and the complexion is pallid and lusterless. If the heart blood is stagnant, then there may be such symptoms as dusky complexion, cyanotic lips, palpitation of the heart, tightness in the chest, precordial pain, and a pulse that is hesitant and intermittent. Here is an illustration showing the physiological functions of the heart. That the heart governs the mind, it governs consciousness, thinking, responsive activities. The heart is the motive force of blood circulation. It has an exterior-interior relationship with the small intestine, and it governs the blood vessels. It has its outward manifestation in the face, opens into the tongue, controls sweating, and controls the apical pulse. The heart is the governor of mind. This function is also known as the heart housing the mind. In Chinese medicine, the term vitality has a broader meaning and a narrower meaning. In the broader meaning, it is the outward activities of the life of the whole body. It encompasses the body's complete form and function, including its complexion, expression of the eye, speech, response, movement of the limbs and trunk, etc. In a narrow sense, vitality is the mind that is governed by the heart. It encompasses the spirit, consciousness, thinking, and related activities. Modern physiology holds that all these mental activities are attributed to the physiological functions of the brain, and these are a response of the brain to the external objective environment. In Chinese medicine, these mental activities are attributed to physiological functions of all 5 of the Zhang viscera. The plain question states, the heart houses the mind, the lung houses the soul, the liver houses the ethereal soul, the spleen houses intention, and the kidney houses the will. Through the activities of the mind have to do with all the 5 Zhang organs, principally they are controlled by the heart. Apart from the influence of ancient philosophical thought, this conclusion is mainly based upon clinical experience. First, the blood is the material support for mental activities. Second, mental disorders are usually cured by methods of treating the heart. The heart's physiological functions of governing the mind and governing blood and blood vessels are closely interrelated. Because blood is the material support for mental activities, when blood is full, the mind is nourished. Only then are the mental activities normal, so that the person is alert, consciousness is healthy, thinking is quick, and responses are prompt. The body then maintains a healthy balance with the external world. Conversely, if blood is insufficient, the mind loses its nourishment. This may be manifested as spiritedness, load, responsiveness, insomnia, and excessive dreaming, forgetfulness, and restlessness, and related symptoms. If there is heat in blood, the mind may become deranged, manifesting agitation, delirium, and even loss of consciousness. The heart's function depends upon the coordinated action of heart chi, heart blood, heart yin, and heart yang. In general, the heart's control over blood and the blood vessels depend upon the heart chi for motive force and upon heart yang for warmth. Heart chi promotes blood circulation and prevents blood stagnation, and heart yang warms and activates blood to avoid stasis due to cold. The heart's control over the mind depends upon an adequate supply of the heart blood and heart yin. If heart blood and heart yin are insufficient, yin blood fails to nourish the mind, resulting in such symptoms as agitation, delirium, and dream-disturbed sleep. If heart 3 and heart yang are injured, heart blood may become static, resulting in such symptoms as tightness in the chest, palpitation of the heart, pain in the heart, and cyanotic lips and tongue. Thank you for your attention.
Diagnosis according to Zhang-Fu organ patterns. We will discuss spleen Qi deficiency and liver blood deficiency. These two patterns frequently occur together, and spleen Qi deficiency will often be the underlying cause of liver blood deficiency. It can therefore sometimes be appropriate to regard them as a common pattern. Spleen Qi deficiency often arises from the excessive consumption of cooling, damp-producing, or difficult-to-digest foods such as dairy products, raw vegetables, wheat products, sugar, sweets, and so on. Eating too much at a time or eating too little will weaken spleen Qi. Worrying or speculating excessively, as well as studying and thinking too much, will burden the spleen. Spleen Qi deficiency will result in a poor production of Ku Qi. Ku Qi is the post-heaven root of blood. This means that spleen Qi deficiency can lead directly to liver blood deficiency. The situation is often further complicated by liver blood deficiency being a contributing factor in the generation of liver Qi stagnation, which then invades and thereby weakens spleen Qi, and a vicious cycle arises. A long-term condition of liver blood deficiency can in itself also lead to spleen Qi deficiency because the spleen will be strained by constantly having to replenish the deficient blood. Apart from spleen Qi deficiency, bleeding and a diet that does not contain sufficient blood-nourishing foods can also be root causes of liver blood deficiency. Symptoms and signs include fatigue, loose stools, fatigue after meals, dizziness, especially when getting up from sitting or lying down, difficulty focusing the eyes, visual disturbances such as floaters, dry eyes, or a sensation of having grit in the eyes, pale sallow complexion, pale dry lips, poor appetite or no appetite in the mornings, craving sweet flavors, the person emanates a sense of fatigue and tiredness, poor posture, skin may be dry and the flesh below may lack tone, weak muscles and fatigue in the arms and legs, depression, sadness, or lack of vision in life, constant worrying or speculating over minor issues, tendency to be weepy and to be extra sensitive in the premenstrual phase, scanty or lack of menstrual bleeding, rigid fingernails or weak and fragile fingernails, pale swollen tongue, possibly with teeth marks on the sides. The tongue may be dry, pale, or orange sides to the tongue. Fine, weak, or choppy pulse, especially in both guan positions. Key symptoms: fatigue, loose stools, pale complexion, dizziness, scanty menstruation, pale tongue. Treatment principle: tonify spleen Qi and nourish liver blood. For acupuncture points, we can choose from bladder 17, bladder 18, bladder 20, bladder 21, stomach 36, spleen 6, liver 3, liver 8, REN 12, and REN 4. Needle technique is tonifying. Moxa can be used on all the points and should be used on bladder 17. Bladder 17 nourishes blood in general. Liver 3, liver 8, spleen 6, and bladder 18 nourish liver blood. Spleen 6, stomach 36, REN 12, bladder 20, and bladder 21 tonify spleen Qi. REN 4 tonifies Yuan Qi and thereby increases production of blood. A person who is spleen Qi deficient and liver blood deficient should eat a nutritious diet that includes a large proportion of green-leafed vegetables, beetroot, black beans, kidney beans, red meat, liver, bone marrow, and other products that are rich in blood. The food should be well prepared and eaten hot. They should avoid dairy products, sugar, sweets, and too many raw vegetables and salads. Spleen Qi and liver blood deficiency can be caused by liver blood deficiency, spleen Qi deficiency, stomach Qi deficiency, liver Qi stagnation, food stagnation. And spleen Qi deficiency and liver blood deficiency can result in Qi deficiency, blood deficiency, spleen Qi deficiency, spleen Yang deficiency, liver Qi stagnation, heart blood deficiency, liver Yin deficiency, ascending liver Yang, and kidney Jing deficiency. Thank you for your attention.
Now let's talk about blood. The topic is concept and formation. A basic concept of blood. Blood is a red liquid laden with rich nutrients and flowing in the vessels. It is one of the basic substances that constitute the body and maintain its vital activities. In order to carry out its normal actions, it has to flow within the vessels. If blood circulation is impeded or there is bleeding from the vessels, its normal actions will be impaired and blood insufficiency can become a cause of disease. The formation of blood is the blood originates from two sources, essence of drink and food and kidney essence. Food essence, the blood derives from nutritive qi and body fluids. These are both generated from the essential substances that principally the spleen and stomach extract from drink and food after digesting them. In that sense, the spleen and the stomach are sources of blood. Prolonged inappropriate diet or impairment of stomach and spleen functions can lead to blood deficiency. For kidney essence, essence stored in the kidney generates bone marrow, and marrow in turn is transformed into blood. In CM, essence and blood can be transformed into each other. In general, if kidney essence is ample and the liver has its nourishment and blood has its replenishment. If liver blood is ample, the kidney has its store and essence has its supply. Thus it is said, essence and blood have a common source. The physiological actions is blood flows in the blood vessels. In the interior, it reaches the Zagfu viscera, in the exterior, the skin, muscles, tendons, and bones. It unceasingly nourishes and moistens the organs and tissues in the entire body, thereby maintaining their normal activities. The physiological state is reflected in a rosy and lustrous complexion, well-developed and strong muscles, well-moistened skin and hair with sheen, and keen perception and agile movement. If blood is deficient, there may be dizziness, blurred vision, lusterless complexion, dry skin and hair, and numbness of the limbs. Blood is also the material basis for mental activities. If blood and qi are both abundant and smoothly flowing, then the mind is sharp, perception keen, and movement nimble. Abnormal circulation due to any cause deficiency of blood, heat in the blood, or abnormal flow patterns can lead to mental disorder. In mild cases, there may be listlessness, insomnia, dream-disturbed sleep, and restlessness. In severe cases, there may be confusion, dementia, delirium, and coma. Blood circulates incessantly in the vessels throughout the body to supply nourishment to all the organs and tissues. Normal circulation of blood requires coordination and balanced circulation. The lung controls the entire body's qi and is the convergence of all the vessels. It assists the heart in promoting circulation. The spleen commands the blood flowing within the vessels and prevents extravasation. The liver stores blood and regulates the volume of blood in circulation. It also helps to keep blood flowing smoothly. It can be seen that the circulation of blood is accomplished jointly by the physiological actions of the heart, the lung, the spleen, and the liver. If the function of any of these organs is impaired, blood circulation may be affected. Such abnormalities as hemorrhage, poor circulation, or blood stasis may result. In addition, cold or heat in the blood can directly influence the rate of blood circulation. Here in this slide, we can see how the circulation of the qi, blood, in the sanjiao is. Thank you so much for your attention.
Let's now talk about dizziness with the patterns liver yang, liver fire, or liver wind rising. There are 5 main patterns causing dizziness, which can be categorized into 2, full and empty. For the full type, we have liver yang, liver fire, or liver wind rising, turbid phlegm in the head, liver yang rising with phlegm in the head, and for the empty type, we have qi and blood deficiency, and kidney essence deficiency. Now let's go to its clinical manifestations. In liver yang rising, dizziness will be quite severe. It will be accompanied by tinnitus, red face, irritability, propensity to outbursts of anger, and headache. The tongue will be slightly red on the sides and the pulse wiry. If dizziness is caused by liver fire, it will be accompanied by red face. There will be thirst, bitter taste, dry stools, scanty dark urine, and the tongue will be red with dry yellow coating, and pulse will be rapid, wiry, and full. In liver wind rising, there will be more severe dizziness. There will be vertigo and loss of balance and tremors, and the pulse will be wiry. The pattern of liver yang as a cause of dizziness is the most common of the aforementioned three patterns. Liver fire is the least common, and liver wind occurs usually only in the elderly. For the treatment principles, in liver yang rising, we subdue liver yang, nourish liver yin or liver blood, and kidney yin if necessary. If there is liver fire, we drain liver fire. In liver wind, we extinguish liver wind. The acupoints we use will be liver 3, gallbladder 20, triple burner 5, do 16, SI 3, liver 2, pericardium 6, liver 8, spleen 6, and kidney 3. We use reducing methods on all points except liver 8 and kidney 3, which should be reinforced. Liver 3 and gallbladder 20 subdue liver yang and extinguish liver wind. Gallbladder 20 is a specific point for dizziness. Triple burner 5 helps to subdue liver yang. 216 and SI3 extinguish liver wind. Liver 2 drains liver fire. Pericardium 6 indirectly helps to subdue liver yang, calms the mind, and settles the ethereal soul. Liver 8 and spleen 6 nourish the liver blood, and kidney 3 nourish the kidney yin. We have here a case history of a 70-year-old man who had been suffering from vertigo for several years. He was very unsteady on his feet and often used a shopping trolley to steady himself while walking. His blood pressure was raised and he occasionally had blurred vision. His nails were very dry and withered. His complexion was dark and his skin dry. His tongue was reddish purple with a thin yellow coating in the center but no coating elsewhere. The tongue was also stiff and dry. His pulse was very full and wiry. The diagnosis, his condition was clearly due to liver yang rising with an underlying deficiency of liver yin. The vertigo was due to liver yang rising, which was also reflected in the pulse quality, while liver yin deficiency was evidenced by the blurred vision, the dry skin, the dry and withered nails, and the stiff tongue. Treatment principle, the treatment adapted was therefore to nourish liver yin and subdue liver yang. The main points used were gallbladder 20, triple burner 5, LI 4, liver 3, and liver 8, spleen 6, and kidney 3. So gallbladder 20 subdues liver yang and relieves dizziness. Triple burner 5 subdues liver yang. LI 4 together with liver 3 subdues liver yang from the head. Liver 3 subdues liver yang and liver wind. Liver 8, spleen 6, and kidney 3 nourish liver yin. After 6 treatments, his blood pressure becomes normal and his dizziness was much relieved. Thank you for listening.